In our classes, we learned that Hippocrates came on the earth some 460 years before Jesus Christ and was accepted as the father of modern medicine. He said in his Hippocratic corpus that disease was created by environmental factors, diet, and living habits. Is that fact still true today?
Yes, indeed, Brother Lewis. That has been the practice for thousands of years until the last 100 years when Big Pharma became dominant. Much has changed in conventional medications and treatment use of laboratory chemicals. Certainly, we can't say that it's all bad, but much of the natural has been left out. For example, I was treated by one doctor whom I had the best relationship that you could have with anyone, any doctor, anyone. And during that 8 years, my PSA would slip up and down, never to an uncontrollable limit. His concern was treatment with the drug. Never once did he ever mention building up my immune system or a good nutritional balance or even recommending nutritionists for my aid. I had to get outside of the box and find this for myself.
Wow. For what many of the studies are showing today, we are in a cancer pandemic. You mentioned 100 different types. What are some of the reasons?
Well, there are many. 60 years ago, the chance of getting cancer was 1 in 50. It's 1 in 2 men, 1 in 3 women, and 1 out of 4 would have some kind of problem with cancer today, 2017. So you can see all the billions of dollars being hustled for research and drugs. It makes me wonder about the money trail, the giant corporation, the environmental watchdogs, the genetic modified foods that they're doing today. And of course, you can't blame it all on him, but our culture itself has simply made a change. Poisoning of the environment, the water, the air, the soil, and even culture. Like I said, we are just taking a nosedive towards abomination.
In our classes over the past 3 years, we examined dozens of methods Hippocrates used in reversing sickness and disease 2,500 years ago. Can you simply give us his take on food?
Yes, Brother Lewis, what he said. And Hippocrates admonished his bright-eyed students, medical students, in one of his precise lectures, "Thy food will be your remedy." And what he meant, was referring to, was the enzymes, the macronutrients, the mini-nutrients, all of the live elements and natural food that is essential in maintaining a living organism in the optimal. This system is based on the idea that correct food, that is natural foods, man can purify his body and find perfect health again. Yes, indeed, food can make or break you. And naturally, with that goes the necessary herbs, supplements, sunshine, exercise, and these kinds of things.
As said from the very beginning of this discussion, many men avoided or cared not to engage in discussion regarding prostate and cancer. Do you see any change in that today?
Yes. Now, of course, I was going back 25 years when I had a long-time club member and a church brother who had that problem with that issue. When I approached him for advice, he refused to discuss it and brushed me off. Of course, I've long since learned that the diagnosis of cancer can be a dramatic effect on one physically, mentally, emotionally, and spiritually, if you let it. Today, it is in the past few years, matter of fact, there has been a virtual explosion in the interest of prostate cancer. as far back as 1990. The founding of a group called Us Too, that's the name of the group, was formed. The American Foundation for Urologic Disease and the American Cancer Society nurtured this group. Some 15 years ago, I even joined People Against Cancer, which at that time it cost me $500 fee just for membership. That doesn't extend all the other money I spent on the things that they suggest I take. I still have that receipt today. Now, you can do your research online and YouTube free.
Is it a good idea to ask a lot of questions and keep a record of your progress when you are being treated for prostate cancer?
Yes, indeed. This goes back to any treatment, test, exam, or interaction of that kind. Coach, as I said, you have to ask questions. You know, I have a list that I slipped in here on questions. But I'd like to go through that list real quick, Brother Louis. So this might help some people. If I can put my hands on it real quick, like. And I don't. Oh, here. Let's do this. And this is just about 20. And there are hundreds of questions because they affect each person individually. But the question to ask your doctor is this, and you might want to write these down, because when you get there in the doctor's office, your mind is going to be fluttering. You aren't going to be able to ask. So what is my PSA level? That's the first question. Does it fall in the normal range? What were the level of my pH at the last test? 3 or 2. Has my pH level changed significantly over time? 3. Is there a reason to recheck the PSA in 6 or 8 weeks? 4. What is the grade and volume of cancer in the biopsies, and how significant is that? 5. What did the bone scan show, if there was one done? What is the results of the CT scan, if there was one done? What is the clinical stage of the cancer, and how significant is that? What is, do you think the cancer is curable? These are the questions you need to push to that guy. What are the treatment options available for me? What are the chances the cancer will progress if it's left alone untreated? 11. How many of these operations do you do in a year? 12. How often do you give blood transfusion during surgery? 13. After surgery, do your patients usually stay in the hospital after treatment? And of course that range should be from 1 to 3%. 15. Are you board certified? When did you take the exam? Now I know a lot of people say, can I ask the doctor that? Yes. You're going to pay him for services, you can ask him. Remember, some of the older urologists are grandfathered in and have certification for life. Now, recently trained urologists have to take this recertification every 10 years. 16. How often should I see you for a follow-up visit after I go home? 17. How soon can I go back to work or resume normal activities? 18. After surgery or radiation, how long should I wait to see if I can still get a normal erection before I seek treatment for impotence? 19. Do you think the cancer is curable? 20. What are the chances that the cancer has spread to the lymph nodes, bones, or other organs? So all of these, plus questions that you should ask your doctor, and not be afraid to ask him every single one, because after all, he's there to serve you, and you and your insurance are paying him.